So we have a couple updates in why finding COVID shots for your young children is still so hard. The first part is because there are two coexisting systems. The first being that children with commercial health insurance get vaccines through the commercial market. So that would be places like Walgreens, CVS, where children could receive shots under 12 at CVS starting October 2nd and at Walgreens October 13th, which is weeks to a month after they were approved for children under 12 by the CDC and the FDA. And the second way is kids with government insurance, such as Medi-Cal, get shots through federally funded vaccines for children program. So this is a governmental program called Vaccines for Children. And this is a very slow-moving program. So what you have to do is call the Vaccines for Children program place. They will actually place an order. The vaccines will come to them. The government has paid for them already, and then they will distribute them to patients who have the insurances for these for free. But note that they're not going to be holding these vaccines for you. You actually have to have the need, make the order, submit the order, have them make the order, get the vaccines go to them, then go to the people that you place the order through, and then you get the vaccine. So it's a very tiered process. And this is problematic because health officials will routinely direct patients first to their pediatrician's office, and that is not the case for people with that governmental insurance. And really even for those with health insurance through the private market, because pediatricians aren't stocking or administering the COVID shot because they can't afford to. And this is because a lot of pediatric practices are small businesses, which means they would have to spend a lot of money up front to be able to buy the vaccines and then wait weeks or months to get recouped. And we've covered that in previous articles. You can go through the playlists to see that. Additionally, pharmacists can only vaccinate children 3 years and older under a temporary federal law. So for children under 3, this leaves out those young children who have to see a doctor, and again, those doctor offices are not going to typically be providing the shot because they have to front the money, and then it's going to take 6 months to a year to get reimbursed most times. Another issue through this Vaccines for Children program is that thousands of doses are ordered and only hundreds arrive. For example, St. John's Community Health in Los Angeles County, they ordered 3,000 pediatric doses, and last week they only got 500 of their 3,000 order, where they're basically not advertising that they have those 500 doses because they don't want to get an overabundance of people coming in for them and then having to deny it because they're out from the short supply. And while in other articles you can read about how CDC Director Mandy Cohen is saying, oh, anyone that can get a vaccine can, my children have got their vaccines from their pediatricians, this is largely not the case for most people in the US. You really think you're not getting special treatment as the CDC Director, Mandy Cohen? And the big problem is that if we want these children to get vaccinated for things such as Thanksgiving and the winter holidays, it's critical that we start doing this now because this is not a one and done kind of situation with kids and babies. Like, we need to be getting them multiple doses over multiple weeks before they can be adequately protected. They have to go on a series of doses over a series of weeks to be able to mount the immune response and be considered protected. And this can't be the case if they can't even get the vaccine in the first place or be assured that they're going to be able to get it again in the following weeks. And as a pediatrician, Dr. Ball says, the only thing that hurts me worse than seeing a child get sick or hospitalized is them getting sick or hospitalized by something that I could have prevented. If I don't have the tools to prevent that, it hurts me and it's very sad. So again, medical professionals, we have the tools, but we're not using them. Ergo, we don't have the tools.